So, welcome to our K Vision podcast. My name is Tina Khanam, your host and eye surgeon in London. We welcome you to this podcast where we talk about all things eye health and well-being. Today, we have our special guest with us who is going to explore with us a topic that is really difficult for women and has been kind of, under the carpet and under the radar, even though it's been affecting a lot of women. So Miss Murthy is the eye consultant and director of face restoration in Harley Street, and they also have a clinic in Jersey. And I will bring her in to introduce herself. Welcome, Rachna.
Thank you, Tina. It's a pleasure to be speaking to you today. Yeah, so I used to be a consultant at Addenbrooke's in Cambridge and Ipswich, and my specialty is oculoplastic surgery and
Yeah,
front of the eye. So very much treating people with autoimmune disease, dry eyes, as well as skin cancers around the eyes. And that's something that I brought into private practice. And it's really an interesting topic for us to explore today.
yeah,
I've spoken in many consumer conferences and at the Royal College of Ophthalmology relating to hormone and dry eyes. But I think, as you say, this is a topic that's really not spoken about enough. And there's research which points in various different directions. So it's quite confusing
yeah.
for the specialists, let alone the consumers.
Yeah, exactly right. I'm just thinking about my time when I was taught about menopause in medical school, not much really. And then since then, I haven't really come across it at all. And
Well,
sorry, I was
yeah.
just going to say
No, it's fine. I was going to say that most of the research has been done on men, so you're not going to study menopause in men.
yeah,
And so there was very little that we were taught about women's health except for disease,
yeah,
and certainly not something that's a normal part of the aging process in medical school. And I think one of my passions and purposes is to rewrite that story and sort of educate people more in terms of preventative health and what we can do, what's normal, what we can actually treat and cure. So this is a really exciting topic for me to share with you.
excellent. Yeah, so we are going to empower you as women to navigate through this difficult part of your journey, and we're going to teach you, or hopefully give you some resources and education about how menopause and dry eyes are linked and how your eye health is important during that time as well. So just
Yeah.
to set the scene, what exactly is happening during menopause to your body, Rachna?
Okay, well, I mean, menopause is a whole journey, really. We think that menopause is when we stop having periods, but actually, the hormone changes can start really early. So, from as early as the age of 36, and people may not get perimenopause or menopause, depending on race and location and diet and all the other things,
Yeah,
until the age of 51, 52. So, there's a huge amount of variation. But the definition is that menopause is when the ovaries will stop producing the hormones, and that's really when you stop having menstrual periods. But obviously, there is a period of time when there are all sorts of symptoms which are put down to all sorts of other things that can actually be related to hormone changes, and that can start really early.
yeah,
So it's really important for doctors and patients to sort of have that discussion about other symptoms that are going on at the same time. It's not always just hot flushes, it's not always brain fog,
yeah,
and that kind of thing can happen early.
yeah.
So it's something that also affects every organ in the body, including the eyes. And that's, as you said at the beginning, is something that's not really recognized. It's maybe brushed under the carpet, or maybe because it's not even thought to be something that is a problem that most people have to live with. So it's not discussed.
I know, yeah. So to be in particular, the hormones that are involved, we're talking about estrogen and androgen, and as you said, it affects the whole body, not just
Yeah.
your
So,
menopause.
I mean, that's an interesting point. So normally, when we talk about menopause, we think, it's estrogen, progesterone, that's sort of the main sort of female hormones, but actually testosterone is an important female hormone.
Yeah,
And as women, we do produce testosterone. We produce it a lot less than men do, but
yeah,
it's something that is very important for lots of functions, metabolic functions, libido,
Mm.
And interestingly enough, it's important for our eye health as well. And so that's where that link we think might be. Um,
Oh, interesting. Tell us more about how common dry eyes are in menopause and how testosterone comes into it.
I mean, dry eyes is common anyway, full stop. And so, I think you will know, and many people, not just as patients who have had some episode of dryness, irritation, or watering, because of course dry eyes can cause a reflex tearing, which is watery eyes and red eyes. And it's also related to styes and blocked eyelid glands as well. So the most common cause of dry eye
Mm.
is when the eyelid glands are not functioning properly and they're not secreting the oil onto the front surface. And I think this is a good time to actually sort of explain that in a little bit more detail because I think I love the analogy of you being in a car. So can you imagine that you get into a car and your windscreen is just covered in dirt and pigeon dropping and whatever else? You're not going to drive the car, are you? And it's that car
Yeah,
window, which is like your clear window of your eye, and your eyelids are the wipers, and your tear film is the washer fluid.
yeah,
And so when that washer fluid is not good quality, or when that tear film is covered in pigeon dropping or whatever it is,
yeah,
then it is something that means that you can't see.
yeah,
And this is something that can be severely debilitating. And those eyelid glands that secrete oil onto the front of the eye is what keeps the front surface of the tear film from evaporating.
yeah,
And when that oil doesn't get onto the front surface of the eye because the glands are inflamed or they're plugged up, which is what happens as we
yeah,
get older in men and women, then that's when the tears evaporate and that's when you can get dry or gritty, uncomfortable eyes and then red and watery eyes as a consequence of that.
yeah,
And in menopause, there was a lot of studies done on hormone replacement therapy, and a
yeah,
large epidemiological studies looked at hormone replacement in terms of estrogen, and they found that some things got much better. So they were looking specifically at heart disease and the improvement in heart disease with HRT.
mhm,
But what they found was actually that dry eye symptoms, which they did check for, they were checking for dryness
yeah.
everywhere, but eyes in particular got worse with estrogen replacement.
Oh,
Now
wow.
it's difficult to put a sort of direct link between estrogen replacement and dry eyes
Mhm.
because we don't fully understand dry eyes, and we know that it's also multifactorial, which means that there are lots of things that can cause dry eyes. And we'll get back to this when we talk about why women are more likely to notice it and at an earlier age than men.
Yeah,
But in the patients who were having hormone replacement with estrogen, there
yeah,
was an increased incidence of dry eyes. And so that got people thinking and researchers thinking, well, perhaps there is a link between estrogen and dry eyes. And is it due to estrogen drops? And lots of companies have made hormone creams and other things to improve skin
yeah,
at the time of menopause.
yeah,
Um, but their research is coming through more and more that actually it's a testosterone drop that is not supporting the eyelid glands. And
yeah,
so by putting estrogen on your face may not be actually helping your eyes. It may help your skin, but it's not helping your eyes. And an optometrist in the US actually developed some testosterone drops. The problem
amazing.
with testosterone is that it causes other things, it causes hair to grow.
Yeah.
Your cat wants to join in the discussion,
And
it's great.
I want to join in. That's
It's all about the testosterone and the cat's interested. What's your
yeah.
cat's name?
Snowball.
Snowball, yeah, Snowball is snowballing into this discussion.
Yeah,
So, yeah, testosterone drops were developed by an optometrist who saw a lot of dry eye patients. And actually, the initial idea for this came about in terms of patients who were on testosterone blockers for prostate cancer, who had much higher rates of dry eyes. And
amazing.
so they thought to develop some testosterone drops, which did improve the eye symptoms. But testosterone on the skin can cause hair growth. And so, you have to balance the risks and the benefits. In the right concentrations, it may well be beneficial, but this is still at the research stage at the moment.
How exciting, because the marketing is so strong. We only think of estrogen in terms of hormone replacement. We don't really think about the testosterone needing replacing as well.
No, and this is the thing, we are very led by marketing. We have social media, like everyone's watching this at the moment, and the power of marketing is immense. And when there is a need and a pain point, you
Yeah,
just need somebody to tell you that this is a solution, and you'll believe it. And
yeah,
it could be snake oil, it could be something that's doing something that's beneficial, but it could also have some side effects, and it could also not
yeah,
help some of the symptoms that you're suffering from. And
yeah,
so, yes, in menopause, testosterone drops, estrogen drops, and it drops far earlier
yeah,
in women than men because they already have lower levels of testosterone. And that's why these symptoms of irritation, dry eyes can happen early on. And of course, we as women tend to wear makeup. So, we're also putting external factors on our skin and on our eyes, and, something that we use very often. In fact, second after lipstick is mascara. And
exactly.
mascara is being used from an earlier and earlier age. So girls as young as 12 are starting to use mascara. I use mascara, I'm sure that lots of people use some form of cosmetic, whether it's mascara or a skincare. And there are particular things in mascaras and skincare which are preservatives because we
Yeah,
don't want to have bacteria that shouldn't be there growing in our pots of makeup. And those preservatives, one of them that's commonly used is something called formaldehyde.
yeah,
And formaldehyde, I think you will know, and for the listeners and watchers, formaldehyde is something that's used to preserve cadavers in dissection labs and pickle organs. And so
yeah,
it's also something used in cosmetics and in shampoos and in skincare. And those things can actually cause inflammation around the eyes
yeah,
and worsen dry eye symptoms as well. And so there is something to do with being a female, with the things that we put on our skin
yeah,
and also in our gut. So I'm doing a lot of talking, but there's a strong link between rosacea and dry eyes. And rosacea is a skin condition that
yeah,
is impacted on by our gut. So what we put in our gut can affect our skin.
yeah,
1 in 10 people have rosacea, and about 80 to 90% of people have dry eyes associated with rosacea. And so it's extremely common. And then you can imagine that you put on top of that cosmetics and other things that can impact the eye surface,
yeah,
cosmetic ingredients, and then also environmental factors, so pollution, mold, all of those things. Then add in what you eat and processed food, and maybe even if you aren't having processed food, you may not be getting the diet that you need to support your whole sort of skin and eye area. Then you've got this perfect storm that causes dry eyes. And
yeah.
that's where we come in, and we then have to look at things to treat dry eyes. But in many ways, it's also about how we can prevent it. And when we start noticing symptoms, there are things that can be done from home, very
Exactly,
simple
exactly.
things that
Yeah.
can be done to reduce it.
Yeah, so the preventive measures that you talked about is really paying attention to those external factors like the makeup that you put on and the food that you eat and the environment that's right.
Yeah, yeah, exactly. And there is plenty of research. So I was part of a huge literature review, a co-author in something called the Tear Film and Ocular Surface Society lifestyle impact of lifestyle factors on the ocular surface. And I particularly was asked to contribute towards the cosmetics one because I sit on the complications faculty for a company called Allergan.
Yeah,
And I support practitioners who do cosmetic injectables and neuromodulators like Botox and also cosmetics and skincare. And
yeah,
so I have some experience with products and devices and the use of these things.
yeah,
And that paper actually was the most read paper in 2024 when it was published out of all of the ocular surface
yeah,
journals, and it is well read amongst consumers as well. I think maybe you can put a link to it underneath this sort of post and video because it's open access. It's really interesting. It talks about the history of cosmetics, but also cosmetic ingredients that can contribute to eye surface issues.
Yeah.
And it is a minefield out there because your cosmetics are not going to be necessarily labeled. They just have to put the most common ingredient in. You won't know what else is in there. But there are particular things, just as a quick summary, that you should avoid near the eyes. So a lot of eye creams will contain retinols. Retinols are great for improving collagen, but they break down the skin barrier, and that's the bacterial barrier that looks after our skin.
Yeah.
And they particularly dry the eyelid gland, so that's something to try and avoid near the eyes. Retinol eye creams, you're better off using a one-off treatment or going to see a cosmetic specialist like myself to treat the collagen underneath the eyelids,
Mm.
rather than putting regular sort of skin retinols around the eyes. Things like changing mascaras so it doesn't have buildup of the nasty bacteria that can cause inflammation. Try and avoid eyelash serums that contain prostaglandin analogs. So look for the word prost.
Yeah.
Eyelash serums came from glaucoma drops originally. So there's a drop that was used to treat eye pressure in 2009. And I was a consultant ophthalmologist in Ipswich at the time, seeing glaucoma patients as well as eyelid patients. And I noticed that actually their eyes looked more sunken and dark
Mm.
and their eyelashes were much longer. And that particular glaucoma drop was then utilized to turn into something that can grow eyelashes
Yeah.
and at a lower concentration. But of course, if you're using it every day, then it can have the same side effects that this glaucoma drop, which was used to treat a disease, can
Mm.
also cause in someone who doesn't have any underlying disease. And it can cause hollowness and it can cause dryness and irritation. So try and avoid those things if you've got sensitive dry eyes.
Yeah.
Um,
Yeah. I
there are
mean,
other alternatives.
I know I can see the appeal of using those lash lengthening drops, but they are used for glaucoma, which is a disease. It's very important
Yeah.
that.
Yeah, I mean, in the short term, it's fine. And actually, my patients come to me and I do take this full history of what they put on their skin and the makeup and also the gut and the supplements and, the whole approach in terms of my eyelid surgery and my cosmetic treatments.
Yeah.
Because I want to look after people as a whole and empower them to, as you said at the beginning, to live their best, healthiest lives. And when they perimenopausal symptoms and menopause hits, that's something that can be embraced and it shouldn't impact our aesthetic or our confidence. And so there are alternatives, and things like peptide lash serums are safer. There are eye safe cosmetic brands that I have introduced into my practice. So, I work very closely with now a good friend, Amy Gallant Sullivan, who has made a cosmetic range called Eyes of the Story, which has no toxic nasties in it. I
Yeah.
work with an AI health tech company called Enbody, Enbodie, and
Yeah.
we're going to be making an app that allows consumers to scan in their ingredients that also puts in the data of where you live,
Yeah.
your hormones, and other things, and it can recommend with red, amber, and green sort of alerts of what things you shouldn't be using and what might be better.
Yeah. That's
So
it.
that's going to help to decode some of that sort of mystery. And I've also developed a product, during COVID or even before COVID, which has helped to treat blepharitis and stop my patients during COVID getting infections. And so all of that is something that I've brought into a protocol,
Yeah.
which I'm now trying to teach optometrists and ophthalmologists as well, although dry eyes is not something that we normally have time to manage in the NHS, and it's very much a private sector thing. And
Yeah.
actually, optometrists can do it very well, and there is a protocol which incorporates these things as well as a special sort of intense pulsed light and low level light combination, which can help to improve symptoms when they're severe.
Yeah, it's a minefield, isn't it? The management of dry eyes, and you really, in NHS, there's no space to manage these patients, and we can offer so much more in the private sector, like those things you've said about the red light
Yeah.
and the
So
IPLs and the Omnigens, and but there's whole gamut of things that we can offer them.
yeah.
Yeah,
It's using the right thing and at the right time. And even, one of the lifestyle reports that came out, it looked at cosmetic procedures as well as elective procedures.
yeah,
And there are certain elective procedures like doing surgery on the surface of the cornea, so refractive surgery, which has the highest impact on the ocular surface and can cause worsening dry eyes. And so if patients are having this type of treatment to improve their vision, and even cosmetic blepharoplasty, if it's not done by somebody who recognizes that it can impact the ocular surface, then you can suffer from severe dry eyes for a long time afterwards. But that can be optimized beforehand, and the tear film can be optimized. And these treatments and
yeah,
removing the other things that you shouldn't be using to disrupt the ocular surface can be looked at before doing any of these treatments. And that gives you then a better, safer, and more comfortable outcome.
yeah. Excellent. I do vision correction surgery, and like you said, the LASIK is the worst category of patient who have dry eyes, and I always have a protocol of maximizing their ocular surface before they have it, and then even afterwards we'll maximize
Yeah.
the dry eyes.
That's brilliant. I mean, you're well ahead of the trend, and it's something that should be routine. If you're thinking I'm going to have the surgery on my eye surface or around my eyes, then I need to look after my tear film because that's the only thing that's going to help me function later on. So
Exactly.
it's no point improving my vision from removing the cataract or changing the surface of the eye if the actual washer fluid is going to be mucky or it doesn't work. And there's no
Exactly.
point improving those wipers if the tear film is not right.
Excellent. No, that is absolutely true. So we have to treat the patient as a whole, holistic approach, and also treat from the outside in. So the lids first and the ocular surface. The other thing I want to touch on is the makeup arena. Do they ever talk about pH of the makeup? Because the surface is so sensitive to pH. Do you know about that?
Not really. So, but that's a good question because the hypochlorous purified spray that I've developed is specifically ocular surface pH, which is very different from skin pH.
Yeah.
And so skin pH is slightly acidic. So makeup normally would be slightly acidic, if anything.
Mm,
And things that are going to be active on the skin
yeah.
are going to be harmful to the eye. So we shouldn't be putting acids that are
Yeah.
strong acids on the eye.
Yeah.
And the eye surface is actually neutral pH, and that's why
Yeah.
things that are neutral will not sting. But when we are putting a combination of things on our skin and around our eyes, some of that will get into the eye, and particularly particulate makeup, so things like glitter, eyeshadow, and a powder makeup. If it's close to the lid margin, so that's between the eyelashes and 5 millimeters below, it
Yeah.
can travel that far into the eye. And there's
Okay.
plenty, and we wrote about this in the paper, but there's plenty of sort of great pictures you can Google about makeup getting into the eye, and that can cause more irritation. It
Yeah.
can plug up the oil glands. So
Yeah.
another thing that I ask people to avoid doing is the practice of waterlining, which is basically applying eyeliner on the edge of the eyelid, which is common practice in many cultures,
Mm,
using sort of thick kohl and black eyeliner. But
yeah.
it can block the glands, and so the oil doesn't then get to the surface. And if you do that for a long time, then it's going to be something that can cause worse dry eyes. And actually, it's more common to see that practice in the Middle East and in Asian countries, South Asia, which is where we also see a lot more dry eyes. And so it's getting that story out that actually there are ways to reduce this, prevent this, but still keep your aesthetic and look good and feel well.
Yeah, this
Um,
watermark and that coal, applying coal, the coal is very alkali, which is toxic to the surface of the eye. So yeah,
yeah,
getting that word out there that you shouldn't be going anywhere near that line is
yeah.
it's very powerful. I know it's very common, isn't it, in those
It's very common, and there's lots of things on social media, like you say, that talk about using castor oil and all sorts of things. Oil is meant to be on the front surface of your eye, but it's your natural oil, your lipids, which has enzymes and all sorts of good things that come out of your eyelids.
yeah,
And they're looked after by your microbiome, which is the sort of trillions of bacteria and viruses that live on your skin, as well as your gut, but on your skin. And it's important not to do anything to destroy that because that's your frontline defense against aging, inflammation, and disease, and skin cancer, and all of these other things,
Yeah.
and then eyelid issues, and then eye surface issues. And so
Yeah.
there are ways to try and reduce that and sort of have very comfortable, nice looking eyes
Yeah.
into old age and having good vision as well.
Yeah.
And there are also, I talk about supplements as well. So there are things that have been shown to have a lot of evidence behind the outcomes in terms of dry eyes. So omega-3
Yeah.
is a good supplement to be taking. Vitamin D can reduce inflammation and also is a good thing to be taking. And there are supplements that look after hormone health in particular. So avoiding phytoestrogens around the eyes. So phytoestrogens are things like formaldehyde and those products. Phytoestrogens in the diet are things like soy. So I've got two boys. I try and get them not to eat too much soy sauce because
Yeah.
that's the things that is very common in our diet because that's the kind of food that they like. But we have to think about what we put in our gut as well.
Yeah.
And so, there are natural testosterones as well for people who can't get hold of testosterone as a supplement through their doctor.
Oh,
Um,
interesting. What kind
and
of
so,
food should we be eating to look after our gut?
well, it's as important to have a good, healthy sort of prebiotic support
Yeah.
to your gut bacteria. So basically, the gut is another analogy I like to use is like a rainforest,
Yeah.
and so the organisms, the bacteria and viruses in the gut are like the creatures in the rainforest, the trees and the plants and the animals, and they are all supported by nutrients that are the rain or the soil. They're coming through the rain or the soil, and those nutrients are like what is called a prebiotic. So it's the fiber that we have in our diet. And
Yeah.
so we have to support our natural microbiome with the right types of
Yeah.
nutrients, and that's the fiber. And then those bacteria and organisms produce chemical messengers and nerve messages to the skin, to our organs, to our eyes, to our brain. And those things are called postbiotics. So you might sort of see or have heard about postbiotics in some supplements. And the microbiome research is evolving. It's something I'm also very, very passionate about. Because we use a lot of antibiotics and antibiotics can destroy our gut. We eat more and more processed food, and even when we don't eat processed food, our soil is not as good as it used to be 100 years ago or more,
True.
because it's very depleted of nutrients. And
Yeah.
so things like zinc and magnesium are great minerals to be having during menopause.
Yeah.
And natural sort of medicinal mushrooms like cordyceps is actually
Yeah.
able to improve focus, mood, energy, libido, and is acting like a natural testosterone.
Amazing.
So there are things that can be done. It's a minefield. Lots of things aren't regulated. And so it's important to seek the advice of somebody who specializes in either dry eyes or in hormone health
Yeah.
and also sort of reach out to apps and things that are able to improve safety and the advice that you receive.
Yeah. Excellent. So there's probiotics, there's prebiotics, and postbiotics to be
That's
had.
right. Yep. Yeah.
Omega-3s, uh,
Yeah.
certain kind of mushrooms that are really good for you.
Yeah. I mean,
Um,
these are all supplements, that's
yeah.
right. But you can get that in your diet, of course. You can eat
Yeah.
sort of porridge oats, you can eat vegetables to support your prebiotic and fiber. You
Yeah.
can take, I think, brands like Myota, which is fiber that's not soluble, that you can have as a supplement that you pour over your food if you
Yeah.
don't get enough of it in your food. And then the probiotics, well, things like the bacterial in yogurt is not really targeting everything. So you can't take a little bit of probiotic and expect everything to be fine because a probiotic is only as good as what it's targeting. And so there are particular brands that have got lactobacilli strains that specifically target skin health. There are other supplements that will support bowel disease like inflammatory bowel and leaky gut. And so there are particular bacteria that research has shown to be beneficial, but there's no point resetting the bacteria
Yeah.
um, and then not supporting them with the right nutrients.
True.
And you can also support them with some postbiotic, which is in some supplements. Then you've got the whole sort of protocol to try and improve that gut, skin, eye axis. But you
Yeah.
don't need lots of money. You can do a lot of that with the right sort of diet, omega-3 and sort of fish oils. So eating more oily fish
Yeah.
and having more sort of vegetables and fiber in your diet is good.
And the other thing I wanted to ask you, and for the listeners, is can you tell us some names of natural food that we can get those testosterone from?
Yeah, okay. So I work with a company called W Wellness and also health.helf and they sell supplements, but it's a minefield if you don't have the support of what you need to have. And so with W Wellness, they have nutritionists, and I'm one of their ambassadors as a doctor, so I can support my patients with the right products.
Yeah,
And there are things like Myota, which is a good fiber blend. There's Hifas Terra, which is an excellent mushroom company that has the highest quality, highest concentration cordyceps. The
yeah,
particular one that if you want to have a larger hit of the cordyceps is something called Hifas Terra Blue Solution, but they also have a menopause one as well with cordyceps lion's mane reishi, which helps with brain fog.
yeah,
And have a diet that's rich in antioxidants, polyphenols, lots of fruits and vegetables,
yeah.
pomegranates, all of those things are also important in terms of reducing inflammation.
Oh, amazing. So basically, it's just all those healthy things we've known about, but we should really be focusing in our mid 30s, you'd say, and then take it on to the mid 50s,
Yeah,
those
I
20.
think definitely look after your gut. I myself and I have my entire family on sort of right food if I can, but I'm not always there to make the right food, and they're always interested in eating not the right food.
Yeah,
So, I'll have them on all of them on a probiotic on a daily basis, as well as some prebiotic every now and again as well. And they are all on omega-3 as well as myself. Vitamin D is really important, particularly
yeah,
throughout the year. We're
yeah,
not getting enough sun. We do worry about sun protection and skin cancer, but at the same time, you have to have vitamin D as well. And so it's
exactly.
and particularly with darker skin, you'll get less vitamin D, and vitamin D is really important at reducing inflammation and reducing the risk of diseases. And so that's all within the diet. And I have everyone on it, and I go through these companies, and I practice what I preach. It's one of the few things that I practice when I
Yeah,
and preach about. My wellness journey also includes things like good exercise, but communities, and sort of self-care. That's all important as well, and all of that helps to improve eye health. And of course, not to smoke. I mean, that's probably the most important risk factor, I think, for eye disease and autoimmune disease. And so
yeah,
to take that nicotine out. So vaping, even with nicotine, can give you higher levels of nicotine than smoking. So
amazing.
that is something that should be looked at to
Yeah.
stop.
So, not many people know this, but or aware of it, that toxins, there are high toxin levels in your nicotine. So we're talking about antioxidants in your diet and your health, and you put in nicotine, which kind of negates
Yeah.
everything.
Yeah. So, I
Um,
mean, in Cambridge, when I used to work, and I led the sort of thyroid eye disease service there and set this multidisciplinary service up,
yeah,
I learnt from my senior colleagues and that the way to immunosuppress patients with autoimmune thyroid eye disease. And at that time, 2011, a lot of the management was strong immunosuppression, steroids, cyclosporin, methotrexate, but, strong immunosuppression, and then orbital surgery. But I, spent a lot of time because this is a service that I focused on one day a week and just speaking to the patients. And they were mostly women at the peak of their career and their lives, and they mostly were triggered by stress or an infection. So that's when I started thinking about the link between infection and autoimmune disease and how our microbiomes are important.
yeah,
And of course, at that time, we looked at using antibiotics to treat sinus infections that was driving the eye disease. And that allowed a lot of my patients to avoid surgery.
Yeah.
and avoid immunosuppression. A lot of the inflammation settled by controlling just the drive of infection to the inflammation.
Wow.
And so fast forward now 15 years later, and I'm now recommending prevention in terms of the right diet,
Yeah.
prebiotic, probiotics. With thyroid, it's also selenium as another antioxidant that's important.
Yeah.
But looking after ourselves from the inside and out can help to reduce disease.
Yeah.
And, it was actually, and I love this, that it was the godfather of medicine, Hippocrates, who first said that all diseases come from the gut.
Mm.
And, he was bringing in that concept of maybe we can look after our gut to reduce disease. And I think we're back full circle almost.
Yeah.
Although, not all diseases are caused by the gut, but a lot of them might be linked with it. And maybe if we can look after our microbiomes, the
Yeah.
skin, the eyes, the gut,
Yeah.
then we can reduce disease and we can reduce dry eyes and we can live through a wonderful journey of our life through perimenopause and menopause without suffering.
Yeah, exactly. So you truly are what you eat, if we're going to take that.
Yeah, exactly.
Yeah.
Exactly.
So I've learned a lot today about, the whole holistic approach of looking after these patients and empowering patients to look after themselves and all the symptoms of dry eyes and the link between menopause and dry eyes. We touched
Yeah.
on the ladder of dry eye treatment. So it's, really getting those oil glands nice and supple and nice and healthy. And then, going on to the red light therapy and the IPLs and the
So it's
whole.
not red light therapy, it's blue light therapy, actually. So the blue light is what kills bacteria. Red light
Okay.
is great for collagen and it's what's in lots of home devices. So that's a question I often get asked. Can I just go
Okay.
under my little home device?
Yeah.
Um, that doesn't give you enough energy and it's often the wrong light. So the right wavelength for reducing inflammation and bacteria is blue.
Okay.
And the clinic devices will give you the equivalent of using a home one 3 times a day for
Yeah.
30 minutes for several years in one shot. And so the energy difference is very different.
Okay. So it's really medicinal kind of device that you need, not the home ones. And the blue light, isn't that toxic to the macula though? So you obviously
No,
no.
no, there's a company called Espansione that we use in our clinics, and they have a light therapy device which treats macular degeneration, and
Oh,
so wavelengths
yeah.
can target different depths. So blue light as a broad blue spectrum will go to different depths,
Mm,
but different wavelengths have been set up in this machine so that it will only penetrate a particular depth. And so blue light is on the surface, targeting the porphyrins in the bacteria. The
yeah.
infrared goes just below the surface, and the red goes on the surface as well for collagen.
Okay.
And then there's also yellow light, which targets the lymphatics. And this is very safe for the eyes. And in fact, it's a treatment for macular issues as well.
Okay. So we shouldn't be worried by the fact that it's blue light and just is going to be what's going to be
No,
targeted. What depth?
no, not with the particular machine that is specifically targeting that. I mean, obviously the home ones are not regulated,
Yeah.
and the clinic ones, which are meant for skin, may not have the wavelength for treating the eyes. But this particular machine is targeting the meibomian glands and the eyelid glands that produce the oils and the bacteria
Okay.
on the skin surface.
What's your take on IPL?
Yeah, I've been using IPL for 4 years, and we were the first in our clinic in London to get something called the Optilite, which is
Yeah.
a machine made by Luminis, and it has the M22, which is for skin, and it has an eyepiece, handpiece for treating the eyelids. And there are lots of studies that show that it can reduce dry eyes, improve the tear film
Yeah.
after 4 sessions, 1 month apart.
Yeah.
And it can also help to reduce Demodex, the mites that carry the bacteria around the eyes.
Yeah.
Demodex is not something that we need to get rid of and destroy because there are natural
Yeah.
factories that walk around our skin and our eyelids, and they'll be there. As soon as you get rid of them, there'll be more that come back. But it's the bad bacteria that they carry, these little trucks that they carry around your eyes, that can cause inflammation. So the IPL does reduce Demodex, it does reduce inflammation, it reduces rosacea, and that's particularly what it's targeting.
Yeah.
And so it's targeting the red vessels that feed the eyelid vessels, that feed the inflammation around the oil glands.
Yeah.
And that combined with low-level light is the protocol that we use, as
Amazing.
well as hypochlorous spray, getting rid of the nasties in the makeup,
Yeah.
and switching that to eye safe cosmetics, and the right supplements. And that's really easy for everyone to apply, and lots of clinics to use, and it's really easy for consumers to get some relief from.
Yeah. No, I am fortunate enough to have access to the IPLs and the light therapy. So, I swear by it because I've seen patients really
Yeah,
benefit
yeah.
from it.
Yeah, I mean, it has to be combined with gland expression and it has to be done by someone who's experienced. Just like you said, it's no point just putting a light on.
Yeah,
Because if you
exactly.
don't know the settings, you don't know the filter, you're not actually going to be targeting. And
Yeah,
also, if you don't do an analysis beforehand,
yeah,
then you don't know whether your outcomes are right. So, looking at the eyelid glands, looking at the skin rosacea, and doing a skin analysis,
yeah.
it's important to be objective about it as well.
Yeah, definitely. And the other thing that I wanted to touch on is the use of, you talked about a lot of inflammation. So, do you have a way to measure the inflammatory load before you start treatment and
Yeah,
after?
you can do. We don't. We rely on looking at the tear film and the meibomian glands rather than inflammation, because inflammation will be um, indicated by things like redness in the skin, redness along the lid margin. You can look at tear film osmolality and look to see whether or not the tear film has changed in terms of it, what sort of chemicals are in there, and so all of those things are helpful. But in my experience, the only thing that's helpful is to get an initial sort of assessment of the symptoms and have an objective record of the eyelid glands and look at the gland oils and how easy they are expressed and look at the skin and then follow up afterwards with the same record.
Yeah, yeah, that's interesting because at the moment I'm part of a research group where we're looking at the inflammatory markers before and after,
Yeah,
and got a little kit to look at it. But it's all in the research phase, and also
yeah.
trying to combine use of amniotic membrane, which is anti-inflammatory, in the dry eye
Mm,
treatment gamut. So that's
mm,
interesting to see
yeah.
what.
Yeah, I mean, when it's very extreme, amniotic membrane might be helpful. And actually, you brought this topic. It's very interesting because we work with some companies that have produced bioidentical exosomes and exosomes that contain particular growth factors.
Yeah,
So originally from stem cells and amniotic membrane or from umbilical cord, but now synthesized, so they're not human origin
mm,
and they can be packaged into little lipid vesicles, and that's what's called an exosome. And those lipid vesicles can be delivered to where you want it, and we can deliver it as an eye drop, or we can deliver it as something that's microneedled into the eye area. And we did a few cases
yeah,
of dry eyes with periorbital dermatitis with this method, and they recovered very quickly. And
amazing.
so there's a lot of promise in terms of reducing inflammation, looking at which particular inflammatory markers are more present in dry eyes and trying to reduce it. But I don't think that we need to go back to the days, and I'm always upsetting drug companies when I speak because from the very beginning when I spoke about Lumigan and the glaucoma drop and the side effects of fat atrophy, I
Uh,
upset Allergan, and of course I work for Allergan, the different
yeah,
branch, the cosmetic branch. But fast forward, and I've spoken about tea tree oil and how tea tree oil shouldn't be used around the eyes, and so I've upset companies relating to that. But the
yeah,
evidence is out there that the concentrations that are used in some of these products can significantly harm the corneal surface, ocular surface.
definitely.
And then we look at things like cyclosporin, so Icurvis, which is an
Yeah,
anti-inflammatory drop.
yeah,
Again, allergen. Um, and I have no reason to, no conflicts of interest here, but rather than targeting inflammation and reducing inflammation, maybe we need to try and prevent it. And that's my whole ethos. And
Yeah,
yes, cyclosporin is helpful. I use cyclosporin to treat my patients with autoimmune disease as a systemic treatment.
yeah.
And also for the eyes, it can be helpful for dry eyes by reducing inflammation. But perhaps we need to take a step back.
Yeah, we start with preventative and then we treat with treatment when it's necessary. That's absolutely
Yeah,
right. So
yeah.
thanks, Rachna. I've certainly learned a lot, and it's been eye-opening about the gut health and the all about the makeup and things like that. And I hope all our listeners will be listening and taking note, and we'll leave some links below so we can.
Yeah, I'd be delighted to answer any questions, or if you want to come and see me, if you've got nowhere with your local providers, and then do be in touch.
Yeah, that would be lovely. So, in terms of finding our services, so you're in Harley Street and I'm in London, and we're all on Google and websites, so and
Yeah.
it's easily
Yeah, but
available.
there are lots of clinics around the country, and this protocol is something that I am disseminating and teaching optometrists to be able to apply. And
Yeah.
so we may well be able to find somebody nearby who has the expertise.
Yeah, great work. Amazing. That's lovely. So thank you very much for being our host. And listeners, I hope you've learned something. And if you want to come back to us, and you can either leave a comment or get in touch with us directly, and we'll be happy to interact and give you those information that you need. So thank you very much. So this was our episode 2 of season 3, and we are having this exciting discussion about how to look after our eye health. And today was quite general, how to look after ourselves holistically, especially in that period of perimenopausal and a menopausal journey, part of the journey of female life. And how it's not just a women's business, how males, partners and husbands can also help in that front. So yeah, thank you very much for being our guest today, Rachna.
Oh, you're very welcome. It's been a real pleasure. Thank you, Tina.
Thank you. Take care.